Yes, everyone here who is coming online, who is be watching me today. It's a nice day. I thank you everyone that will be watching. Today we want to continue with the topic that we had started. The topic that is called heart attack, or we called it also myocardial infarction. So that will be the topic of today, and we welcome everyone who is coming in. If you are coming in for the first time, what you need to do is to do what? Hit the like button and come to the chat. Tell us which side of the country, which kind of the globe, in America, in Kenya, in the US, which side are you watching from? Which side are you watching from? Thank you everyone who is coming in. I can see Jamaican uncle, blessings to you, Dr. Benjamin, and everyone in the stream. I'm outside doing my walking right now. Healthy walking always. Pick up every time, uncle. And I've said that today we're gonna have like only 1 hour. 1 hour will be the today, because my time today is limited. So everyone who is coming in, welcome. This is Dr. Ben. Dr. Benjamin is a medical clinical practitioner, and we come online and discuss medical issues, mental health issues. We discuss many things concerning our bodies and the mental social life. So if it's your first day to this chat, don't fail to come and say where you are from. Don't fail to tell us which side of the country, which side of the world are you watching from. It's very important we know. Subscribe to the channel. Don't fail to subscribe. This is a good channel. It's a channel whereby positivity is the maximum flow. So come to the chat. If you are watching me for the first time, tell me where you're watching from. Today we want to discuss other types of myocardial infarction. In simple terms, we say heart attack. And you remember I said myocardial infarction is a term just to say heart attack, because myo is a word that is used to say heart muscles, and cardio is the heart. Anytime that is added a suffix cardio, that is a heart. And then infarction is cell death because of lack of oxygen. So we say heart attack is muscles death because of oxygen that is not enough. And why? We saw the main thing is the Tamaza Lament from Russia. Welcome, Tamaza. Big up every time. Russia is a good place, right? Welcome. Hope you have subscribed to the channel, Tamaza. Big up every time. Thank you for joining and tuning in this chat. So you subscribe and interact with the guys and the people that will be on the chat. Let them show you the way. We have so many people that will be here, so don't worry yourself. Just come in and interact with them, and big up every time. Tamara has retracted that message. Yeah, Tamara don't want to know people. I don't want people to know where he's from. Who else are you? Who else is watching and this is the first time? If you're watching and this is the first time, come and tell me where you're watching from, my friend. Come and tell me where you're watching from. So we talked about heart attack, and we divided them into two ways. The first type of heart attack is the one that the ST on the ECG, it is categorized by the ECG machine, whereby the S wave is elevated and the other one is normal. That one only shows one of, I don't understand you, unfortunately. Oh, English. Let me text you and use translator. At Tamaz, don't understand me. At Tamaz, use translator. Use translator. Tamaz, use translator to understand English. I know everyone who watches do not understand English, and you can use a translator, Google as a translator. And don't forget to subscribe. Don't forget to like and subscribe. Yeah. So let's continue. So we divided into, there is a machine that is called the ECG, electrocardiogram, that shows us the division. It only shows one is the coronary arteries, the blood vessels, these ones. If you have the first time, you can watch the other videos, but we say there are two vessels here that are called the coronary, right coronary artery and left coronary artery. Occlusion. If they are blocked, you will see something like this. If they are blocked, you will see something like this here, elevation like this. But if they are not blocked, it's normal, you will see something like this, PQRST. So ST elevation shows a blocked coronary artery, So that is according to the electrocardiogram. But there are other ones that we discussed yesterday, is potentials, and the other one. Let me revisit what we did yesterday before we continue. We talked about supply, demand, and potentials attack. Supply demand is whereby your vessels, your blood vessels, your everything is okay, but there is no blockage. But the problem is, maybe you have anemia, maybe you have pneumonia, you see, maybe you have genetic problems, like those ones are the ones that like you have hypertension. I can see Dorothy K, big up yourself every time. Welcome Dorothy K. So you can have heart attack because of pneumonia, you can have heart attack because of anemia, you can have heart attack because of I'm fine, Dorothy, I'm cool and fine. I'm just going through what we did yesterday before I introduce another thing here. So you can have something that is called coronary artery spasms, and you have an attack, a heart attack. So those are the things. So we have divided them into two. ECG machine, electrocardiogram, that we put probes on the chest, and then we check your heart, how it is working, only tells us with the ST wave. The ST wave is this wave. Those things that you see in you see this ST, if it is elevated like this, it only shows that one of the heart vessels, the coronary artery vessels, is blocked, or it is narrow. So if it is narrow, it may bring something else. It may bring a slightly elevated. But here now we have non-ST elevation, non-ST elevation. Non-ST elevation, it may be, maybe it is not fully blocked, it's just partially blocked, So those are the types of heart attack that are supposedly to be in whatever that we are seeing. So Jamaican uncle here, welcome. Dorothy K here, welcome to the chat. Every time, if you are here and you have any question that is medical, don't fail to ask the question. Just come on and ask the question. Just ask the question and we continue. Now, there are some things that we need to talk about, like a patient just walks in hospital. Before he's seen, the patient dies. The patient goes down and we say it's goodbye. The patient dies before the test to confirm elevated biomarkers. Type 3. That is type 3 cardiac heart attack. Uncle, where are you from Monday? I don't see you. Uncle is always here from Monday. every time, Dorothy K. Uncle is always here. I think the time that you log in, maybe he's busy doing something. Even when he's watching Marwa, I usually see him there. So let's not talk about type 3 because type 3 is end of everything. Let's talk about type 4. Type 4 myocardial infarction. I don't like talking about deaths. I like talking about things. No, in his channel. Oh, Sunday we were with him. We were with Uncle on a live, I remember. On Monday, I think he was busy a bit. Let me check type 4. Type 4 heart attack. Type 3 is sudden heart. Type 3 is death. But type 4 is heart attack occurs as a complication of percutaneous coronary intervention. This procedure commonly known as coronary angioplasty without stent placement, which is performed to open blocked coronary artery. So, type 4 heart attack is where you have gone to a hospital, you have partial blocks of the coronary arteries. Maybe there is a clot. Maybe there are some cholesterols that are blocking the coronary vessels, and we are under operation. And then, because you are putting some vessels inside, there is the blood supply deprived. Because when you are putting something inside a vessel, it stops blood from going to the other end. So you kind of like get a heart attack. You kind of like get a heart attack. This is called type 4 myocardial infarction related to heart attack. But if I read these names, someone will tell me, Doc, those names are very complicated. Like myocardial infarction, we have explained it. But that thing that I'm saying, when we are unblocking the blocked coronary vessels, when we are unblocking them, it is called coronary angioplasty with or without placement of stent. Angioplasty. So if you are new to the channel, please ask any question that is medical. Today we are just talking about heart attack, the other forms of heart attack, but I've really explained what a heart attack is. I've really tried and explained what a heart attack is. So for everyone that is here today, the first time, come to the chat, tell us where you're watching from. Let's communicate. So the type 4 one is whereby you understand. The type 4 is whereby you are in a procedure in a hospital. You are in a hospital and you are doing some procedure to open the blocked vessels, to open the blocked vessel. But because you are inserting some catheters, catheters are like pipes. They block the blood going the other side, because percutaneous means you are entering the vessels, and then you are kind of like blocking the blood from going the normal way. So when you block them, it does what? You start having some problems. And you lack oxygen to the other end, because it's only blood which can push oxygen to the other end. Right. Percutaneous PCI, percutaneous coronary intervention, is the procedure which can cause heart attack. And I've said it is the procedure to open when you are opening the blocked vessels, percutaneous coronary intervention, it's called like that. You cause blood not to flow well, then someone gets a heart attack. In simple terms, that's how I can explain. Percutaneous intervention are minimally invasive procedure in which a cardiologist inserts a catheter through the wrist radial artery and then goes to the heart or groin, femoral, advance into the coronary arteries, inflates a balloon, widens the narrow artery, usually inserts a metal stent to keep the artery open. You see, that one is percutaneous. So, Ahmed, big up every time. I can see Ahmed is here. Ahmed, big up every time for your like and always being here every time for your intervention. Let's talk about something that is called what are the diagnosis criteria or criteria? So when you are in theater, within the 48 hours after PCI, 48 hours, that is like a day. So you start having problems after theater, and the problems we look at, we see that, oh, this problem is because of lack of oxygen in the heart muscles. And we take your blood and we go and do something that we call cardiac troponin, because it's the marker that goes up when your heart muscles are dying off or they are destroyed. We see more than 5 times the 99th percentile. More than 5 times it's high in patients with normal baseline values. And when we see troponin is a biomarker, you know, when your cells die, the muscles of the cells of your heart dies because of lack of oxygen, they release troponin. It's like the thing that comes out when cells are dying. So your muscles are cells. So when they are dying, they release troponin. So when we see they are 5 times high, and at least chest pain suggestive of ischemia, lack of oxygen. Ischemia is lack of oxygen. New ischemia ECG changes. We check the ECG, we see there is, we check the ECG and we see there is this raise in T, ST elevation, instead of T being like this. You know, this is the normal, but when we look at the ECG and then we see that it's like this, we know, we have done we have opened the coronary vessels, but there was a problem. So we develop, we check on the Q wave, we check on the imaging. Imaging is those machines that we use. People always say, he was put on those machines that brings waves. Today, after yesterday's topic and previous day, you have known what these waves are. So you can go through our videos previously and know. Angiographic evidence of procedure complication and what can be the cause after theater. In theater, the causes of you getting a heart attack, and you have seen people in theater have been getting heart attacks during percutaneous coronary intervention, PCI, percutaneous coronary intervention. Several problems may lead to reduced blood flow like side branch occlusion, distal embolism of debris. You know, sometimes when you are doing a procedure, blood clots, some debris are remaining. Coronary artery dissection, you want to divert an artery, coronary artery perforation. Sometimes an artery has been perforated and blood is clotting as it's bleeding. Acute thrombosis. Thrombosis, you may find blood clots that are there are also bringing some problems, some blood clots. Slow flow or reflow phenomenon. Slow flow, coronary artery spasm. When you go to an artery and you are kind of like doing a procedure and artery is injured, do you know what they do? There are 2 things that I said arteries and veins produce. Nitric oxide and endothelins. Nitric oxide and endothelins. Wait a minute. So when they are produced, your veins constrict. When your veins constrict, you have been doing a procedure as a doctor. Yes, if you have a question, please ask any question. Ask any question. So when you are doing a procedure and then you injure or you touch a vein, it produces nitric oxide and that vein constricts. So when constriction happens, the endothelins, it produces the endothelins. Endothelins constrict nitric oxide dilates. So, and when it produces endothelins and they constrict, the blood supply to the other end does what? Reduces. So that is it. But after some time, when it's releasing some nitric oxide, it becomes better. It becomes better. So that is how after theater you can have these problems. These problems of type 4. Type 4, you see, you can go to theater as you are working out and things are good, and post 48 hours after the patient has come out of theater, these are the complications that happen. Convulsions, thrombosis, constriction because of several things. These are things that happen. Risk factors are very many. Risk factors of people who can get this after theater, people that can, and I'm talking about problems when it comes to procedures concerning heart vessels. So there are some risk factors that are involved when you are taking a person to theater, and you really want to be careful because of this person. This is a person who is diabetic. When you're taking this person to theater to do a procedure that is concerning the heart, you should be very careful. Very careful of clots, constrictions because of endothelin release. Elderly patients, and you have seen some elderly patients when they are taken to theater. When these patients are taken to theater, you can, like, sometimes some doctors say, no, we cannot take this patient to theater. Why? Because maybe it will be fatal. Elderly patients, there are some anatomy. You are born with a complex heart. There are some hearts, people are born with some hearts that are complex, complicated heart vessels. Maybe when this person was born, the person was born with something that is called tetralogy of Fallot. Transposition of the heart vessels, they are called cyanotic heart complications. We talked about them in somewhere. Complications of heart vessels. And when this person was born with tetralogy of Fallot, some times ago, he was taken to theater and everything was done, and this person was okay. And now is having myocardial infarction, and you are again, as an adult now, taking this person to theater. Problems occur. Calcified arteries, multiple stents. You have taken this person to theater several times to put stents to help, like, the veins. You see, those are things that should be at risk factors. And how would you know that this person after theater has had a problem? This person comes out with chest pain, shortness of breath, sweating, palpitations, arrhythmias. And arrhythmias are like a bradycardia, tachycardia, and fibrillations. Those are the types of arrhythmias. And I tried to explain yesterday about these three things, how they are, how they are. So it is important, elevated troponin to check troponin elevation, because the heart muscles are dying. But now the problem is you have just taken this person to theater, and that again needs this person to, because immediate management needs to repeat coronary angiography if needed. If there is some blockage in the veins, you repeat. Those arteries that are blocked, redilate, make them bigger. Aspirate the thrombus, things that are blocking the veins. You put this patient in something like clopidogrel 75 milligrams. They are called blood thinners, and aspirin or aspirin. Clopidogrel is called P2Y12 inhibitor, enzyme called P2Y12 inhibitor. You see, so these ones are very important when it comes to theater. And you know now, type 4 means that this person has been in theater and is bringing some complications again of heart-related complications. Now let's check the last one. The last one is called type 5 MI. What some people call it CABG complication. So if you have any question, my friends, it's your time. You can ask any question. Now, some people may have artery bypass, grafting. Some part of the artery, let me get a paper and explain that. Some part of the artery if I was a carpenter and you are a lady, would you marry me anyway? That's my baby. I'm trying to draw something to explain a graft. You know grafting, like the one that we do for plants. Like this one. So here you see, this is a blocked artery with occlusions. You take a graft one, you take this, you cut the same size, you cut here and you graft it so that this blood can continue flowing, can continue flowing. You see? But before it was not flowing. So this is the graft, but now, previously it was blocked, but now you cut this graft and you place it. You have cut this place here. See? So this is it. So it is called CABG related. Type 5 myocardial infarct, it's a heart complication of coronary artery bypass graft. So CABG, coronary artery bypass graft, is also a complication because it's an operation performed improve blood flow to the heart by bypassing blocked coronary artery using blood vessel grafts from another part of the body. So maybe they take this from another, this one, the coffee cakes, welcome coffee cakes. They take this from another part of the body, they bypass. You can even leave the blocked one. You try, but you know when you tie it will die. The better thing to do is to cut. So it's only you bypass. Doctor, welcome coffee cakes. Like this, like that. You see this? So this is your heart vessel that is blocked. So it was blocked here previously, and now it has been, you take this from another part of the body, an artery, you bypass like this, and then blood flows. This one is another complication. There are some places you take the artery, internal mammary thoracic in the chest, radial artery or graft venous. You take and you bypass. And you know, type 5 is another one. It will start getting the troponin up like 10 times. When the cell die, it may bring Q wave that is elevated. Q wave. This one. Because dilation of the heart vessels and relaxation. So, okay. Now, Coffee Cakes asked, so what happens to the other part of the body that you took off? There is something that I want to explain again. It is called anastomosis. So, anastomosis is a part of your body that helps blood to flow, even if one part of the place is blocked or cut away. So, it is called anastomosis. It is like this one, like this. Let me draw an anastomosis, you see. A very funny thing, anastomosis. Anastomosis. And you have anastomosis at several places in your body. Several places in your body. Coffee Cakes is taking coffee. Coffee Cakes, you are taking some coffee, eh? So, so this is called anastomosis, my guys. This is called anastomosis. I'm drawing an anastomosis. I want to draw so that you understand. If you cut some blood vessel from another part of the body and the other one is left, it will still. Yes. Coffee Cakes, how are you doing today? I hope your headache has gone down a bit. Okay, let's see anastomosis. This is called anastomosis. So, this means these are supplying blood the other side. These are supplying blood the other side. So if I cut here, this blood vessel will continue getting blood because this one is serving blood inside. Let me draw this one. Yeah, look, I'm in the background listening. Doctor, gonna shower and go to bed. Oh, it's okay, no problem. Look here. Oh, in the background listening. Johnny Be Good is in the background. Johnny Be Good, big up every time. Thanks for joining, Johnny Be Good. Thanks for joining. Look here. So this is called anastomosis in your body. Explanation is, I want to go and cut a part of the blocked artery in the heart. And I don't have anywhere to get the replacement. So I go to your thoracic anastomosis. I find a vessel there. I cut like this one. And I block here. So it means even if I have cut this, I have cut this one. And I've tied there. Still blood will come to this anastomosis and it will go the other side. So these vessels will still get blood. You get? That is the work of anastomosis. These things are located everywhere in your body. Several places. So if you get from the thorax going to the chest, there is anastomosis. There is anastomosis, you get. They help you, even if you are bleeding from one side, the other side can get blood. There is something that is called arterial anastomosis between two arteries. There is something that is called venous anastomosis between veins, and there is arteriovenous anastomosis. between arteries and veins, and there is lymphatic anastomosis. So, have you ever known one type of anastomosis is in your brain? No, not a cadaver. There is a time I drew something like, you know, the one that is called Circle of Willis. I don't know, let me get it. Circle of Willis. Trying to find the Circle of Willis. Where is the Circle of Willis? Oh, it's here. It's here. Look at this. Your brain has an anastomosis called the Circle of Willis. They don't have anything that comes back, like, you know. So this is called anastomosis. So if this one is blocked, the brain will still get blood from this side. If this side, like this coronary artery, is blocked, this one is called common carotid artery. If this common carotid artery is blocked from here, this whole side will get blood, because this other right common carotid is bringing blood the other side. So if, let's say, common communicating artery is blocked from here, blood will come from this other side. So the Circle of Willis, this Circle of Willis is also called anastomosis. You see how God know how to, let me see if God knows how to create things, huh? I'm checking my internet, it's bringing. King Ray, hi, how are you doing, King Ray? Hope you are doing good. Hope you are doing what's happening here? You're doing great. I'm trying to check my net of. There is something with the network here I'm trying to create. Yes. Coffee Cakes is here. Hope the network is back. Let me see. Let's see. Good one. Is everyone getting me well? I've interfered with the network a bit. I think I'll be working on it. So that is called anastomosis. Anastomosis is how, let me work on this. That is how you can get blood even after the other side have been interfered with. So those procedures are always causing some issues when it comes to heart complications. Let me big up some people, my friends that have just joined the chat. Let me big up Marcia Thompson. Marcia Thompson. This thing is bringing me a news. Marcia Thompson in the house. Let me big up Johnny Be Good. Let me big up Jamaican Uncle. Let me big up Jay Kingray. We have not talked for so long, Kingray. Hope you are doing good. Thanks for tuning in, Kingray. Let me big up always Jamaican Uncle and Coffee Cakes also. But Coffee Cakes, I hope you are doing better and doing good and continuing well. So that is the question that the Coffee Cakes had asked. So the circle of Willis on your brain, that is one of the anastomosis. Yeah? It's located in the brain. Yeah? Anterior communicating artery. You have seen them. I had drawn. I've shown you. There is scapular anastomosis on the shoulder here. In the shoulder region, there is anastomosis. Elbow anastomosis. Granular genicular in the knee. In the knee, there is anastomosis and pulse here, and the foot at the plantar region. So those were the places. We will learn about them one day, doctor. But they have to be cut through skull to get or go through nose. No. If we want to get an anastomosis, a graft, we can't go to the brain. We better go to the one that is in the chest or on your knee. You cannot go to unless the one that is in the brain has a problem, so that you can go there to repair. But the last place we go to get anastomosis is not the brain. Yes, you can kill that person as you start doing. You see, so we go to the other sides of the body, not there. So that is type 5. Type 4, we were talking of heart attacks. Type 5, heart attack, whereby you are trying to save this person by grafting a vein, but another thing comes up, troponin rises, occlusions, blood clots come in. So wherever you are repairing, you take the anastomosis from. And it depends with the problem. If it is embolism, you just remove the clot and you leave the vein. You see, unless that place of the has died off, or part of the artery is having a spasm that is constricted and you can do nothing, that is where you get anastomosis. Or you can a part of the place of the artery can be destroyed, in that even you cannot repair, maybe by trauma or something else, or it has been eaten by bacteria until you cannot even repair. That's when you just go for anastomosis, a graft. You get. So those are the types of heart attack. So there is other types of heart attack based on the area. There is one that I've left 3 because it is death. That one you cannot do something. Sometimes when death has occurred, even if you do what, you cannot help. So I don't like talking about death every time. So we have types based on area of heart affected. Anterior wall, wall, MI. That one needs us to talk with a heart. This is the anterior wall. So there is coronary artery that brings something that is called left. This is the right. Left anterior descending artery. This, the one that is going, you see it is here. the one that you see it is here, it comes and it serves the anterior part of the heart. So if it is blocked, the artery is blocked, we know this place is suffering. You see? So we call it anterior wall myocardial infarction. Anterior wall and inferior wall myocardial infarction from the right coronary artery, because it comes like this and then it comes and have branches and it serves this area. You see, it serves this area of the heart. So we know that those ones are given, even you can find them with an ECG, because you know when you are putting an ECG in the chest, when you are putting those probes in the chest, the probes, there is a picture that I had drawn those probes in the chest. You will see like V1 and V4. V1, let me get it. Now let's use this picture that we had drawn sometimes early. This just here. This is a chest of a person. So you will find that and check on this. I want you to check on this. These are the probes that we place, and it gives us these electrical impulses. These electrical impulses. These ones. It gives us these electrical impulses. You see. So let's see about this. Let's see about this. This is a chest probe from an ECG that we placed. So V1 to V4. V1 is here and V4 is here. The heart lies here. So it is looking at the anterior wall. V1 and V4, they are looking at this heart here. So you will know the left coronary artery that comes here has a problem. V1 and V4. And if it is right coronary artery which comes to the down here, you will get that V2, 2, and 3, where is 3? And 3. And augmented something that is called AVF, it will place it in your foot, is elevated. You see, augmented velocity foot here is placed in the foot. Complications, blandicardia. You know, this is how we know how your heart, by placing these probes. And I know some of you know how they are placed. Yes? So that one will learn about them on a good day. Just a minute, I take something and come. So, my dear friends, that is how we know which part of your heart is having a problem. You see how we do things. These things you just have to follow for slowly by slowly. They are not so hard things. They are things that someone can learn and know. There is right ventricular MI occurs with an inferior. On ECG, you'll get ST elevation. The one that I've seen on ECG, you'll get this. So this is how things are. We do them when we want to find the problem of a person in the heart. Mostly, we are really relying on the ECG. So if any one of you have a heart complication, or you have been through a heart complication, I would really advise that you be doing ECG each and every time to check, because the ST elevation and T elevation is the very important key marker in these issues. So we have talked so many things about how to make your heart, how to take care of your heart, and how to the health of your heart. And even if genetically you are born with complications of the heart, you need to know how to get intervention to take care of your heart. It is very important. Whatever we do as human beings is what can make you have a myocardial infarction, or is what can make you have a heart attack. As we started talking, we said risk factors may be those ones that you can modify and those ones that you cannot modify. So those ones that you can modify, why can't you stop taking alcohol a lot? Why can't you stop taking smoking cigarettes every time? Why? Sometimes these things you can manage by yourself, but some things in life, like having distress, headaches because of depression, they only need a balance in life. So my friends and everyone, anyone who has a question, today I said I'll have a shorter session. If you have a question, I would like you to ask so that I go and do some work, because I have to do some things for some people here, and it's important I get to do them. So if you are here watching and you've been here throughout, thanks a lot for being here. If you have any question that you would love to ask anytime, the email address is always open, and my number, the WhatsApp number, is always open. So big up every time, every person. Thank you for watching. Let's meet tomorrow or at night. Bye bye. See you.